All right, so good morning. So let's see, start with our lecture schedule. So this is the week of September 14th through the 17th. We actually got through chapter 4. Let's see. So we've already done chapter 4, right? We already did our tissues, right? So we're actually going to go a little bit into chapter 5, and that'll give us some time to review before the exam. So we're going to go ahead and start chapter 5 today. Don't have your essays graded on your first exams. We'll be getting those graded. I will probably do a review next class. So Thursday, probably have a review over exam 1. And what I would like to say about that is, you know, a lot of you did extremely well. Some of you probably didn't do as well as you wanted to, but it's just the first exam, so don't panic. And it gets better after this because, I mean, cells and tissues and chemistry is not usually most people's favorite subject and not always the thing they do the best on. So if you didn't, you're not alone, and it usually gets better. So it is still possible to pass the class. If you didn't pass that test, it's still possible to get a higher grade than passing if you didn't do as well as you wanted to do. So don't panic. All right, I just wanted to go show you that. And so we do have a quiz. We will have a quiz Thursday and Friday of next week over chapter 4. Okay, so just want you to be aware of that. And the following week, you'll have your exam over chapters 4 through 6, which is why we want to kind of keep moving so that we can get through. So we have time to review. We're not just covering it by the time you get to the exam. This is coming up in a couple of weeks. You have this exam 2 case study. I'll talk to you more about it each week, but just make sure when you get to it, there's usually a video that goes with it, some reading. Don't blow it off. Do your best on it. Watch the videos. Read the stuff that goes with it to answer the questions. And you know, it's something that's really, really important. All right. So let's go ahead and start chapter 5. All right, so chapter 5 is over integumentary system. So this is kind of the first body system that we're going to cover. All right. Sometimes you consider it an organ. Some people consider it an organ system. All right, let's start with a little bit about body membranes. Integumentary system is a cutaneous membrane. Your skin, associated hairs, nails, and endocrine glands. So if it's your hair, your nails, endocrine glands, or actually it's not endocrine, exocrine glands, excuse me. All right, because endocrine is in the endocrine system. Exocrine glands are separate. As well as your skin, that is your integumentary system, which is a cutaneous membrane. So your integument, you may just think of it as skin, but it's actually more than 10% of your body's weight. Okay, takes up to 2 square meters of surface area. Okay, and again, you may not think much of your skin, but it has to be able to withstand a lot. Right, has microorganisms that are trying to get into your body, gets hit by sunlight every day, exposed to different chemicals, gets abused and abraded, right? And it's something that we focus a lot on. And, you know, our culture is a very appearance-driven culture, so we spend a lot of time making our skin look good. The integumentary system has 2 main components. We just talked about the cutaneous membrane. That's your skin. We'll learn more about these terms later. The epidermis and the dermis are parts of your cutaneous membrane. And your accessory structures, those are your nails, your hair, and the exocrine glands. Okay. right, there's another layer beneath the dermis, and that is your subcutaneous layer. That's also known as the hypodermis. Remember, hypo is low or under, so it is below the dermis. And it forms a barrier between the integument, or your skin and cutaneous membrane, and the deep fascia that surrounds your organs. So what does the skin do? Okay, this looks like a good short answer question. Okay, also could be some multiple choice, like which of the following is not a function of the skin, or which of the following is. All right, protection. Obviously, your skin covers your body, right? And it keeps you from getting exposed to certain diseases. It's a barrier. Protects your tissues and your organs underneath your body, or underneath your skin. Also plays a role in excretion, okay, releasing waste, okay, helps you get rid of body fluids as well, things like salt, water, okay. Temperature regulation, okay, keeps you from getting too hot or too cold. Helps you make vitamin D. Your skin gets exposed to sunlight, your skin reacts to that by making vitamin D. Your skin actually does store some nutrients, okay. And your skin provides your opportunity to sense things, okay? You have receptors for temperature, pressure, pain, and touch, okay? All right, your epidermis, okay? It's a barrier, right? It keeps microorganisms out. So most of your body is composed of a certain kind of skin that we call thin skin. It has 4 layers of cells that make keratin, or keratinocytes. And these keratinocytes are extremely abundant in your epithelium. Now, there's another type of skin what we call thick skin. We'll find that palms of your hands and the soles of your feet. It's the only place where you'll see it. And it's different in that you have 5 layers of keratinocytes. And we're about to talk about those layers now. The thin skin has 4 layers, thick skin has 5 layers. Okay, so everybody say that with me. Thin skin has 4 layers, thick skin has 5 layers. Okay. You'll probably see some sort of question that asks you to make sure you know the difference. All right, layers of the epidermis. So stratum is a word that we use to mean layer. Okay, so stratum means layer. So we have stratum germinativum, spinosum, granulosum, lucidum, cornea. All right, so those words don't mean anything to you yet, but they will. Okay, we'll start with the lowest or deepest level, the stratum germinativum, also known as stratum basal. Okay, so when we say basal, we mean like the base, like the foundation. So it's the lower level. Okay, so that should help you remember it. When we say germinativum, we're talking about germ cells. Another way of describing that is like they're almost like stem cells. Like they divide a lot. Okay, so they are the precursor to all the other layers. Okay, these cells are cuboidal, 1 layer. So how would we describe that type of? We would say that is simple cuboidal, right? Very good. Okay, because it's at the lowest level, it's in contact with the dermis underneath. Very mitotically active, lots of divisions. But remember, generally speaking, when we talk about characterizing epithelium, we're talking about the apical level. I was just trying to get you to think about that terminology that we used before. All right, so other characteristics here that you'll see are what we call epidermal ridges. Okay, so these are projections of your epidermis, or cells of your epidermis, into the dermis. And they form a wavy pattern that interlock with dermal papillae in the dermis. So one way of looking at it is like if you look at your hands. So if this is my epidermis, my fingertips are my epidermal ridges. And they interlock with the dermal papillae from the dermis. Okay, that's kind of what it looks like. Okay. So you have ridges on palms of your hands, the soles of your feet, right? So it's like our fingerprint. Now, they're unique to you, so they do provide some level of identification, but they serve another function, or more functions. They help you grip things, okay? So it's like if you have shoes, if you're going to go out and maybe go hiking or go do different types of things, do you want shoes that have just smooth soles on the bottom? Are they going to help you grip the ground? No, right? You want soles that have some ridges in it, okay? Now, they also increase your sensitivity in your skin because, again, you're sort of increasing surface area, allow you to sense things better. And again, these epidermal ridges or your fingerprints, all that is all genetically determined. Okay. Interesting fact, fingerprints are not something that's new. I know, you might watch CSI or NCIS or some of these different shows, but I mean, people have been using fingerprints to identify people for more than 100 years. Okay. Now, these basal cells are germinative cells. They are the predominant cell type in the stratum germinativum. Again, they're stem cells. They divide so they can replace cells that are lost. So as basically you make cells, they rise up. Okay. Now, the skin cells that you have at the surface, do they last forever? No, they're always getting, they're dead at the point where when you see the cells on the surface of your skin, they're really already dead. So they're not going to last forever. So they have to be continually replaced by the basal cells. You also have Merkel cells, named after famous scientists. Okay, these are specialized cells in your epithelium, and they send signals to your nervous system, okay, about objects that come in contact with your skin. So they're sensitive to touch. You also have melanocytes, produce pigment. And recite means cell, melanin's a pigment. And how active your melanocytes are determines how much melanin you produce, which, in turn determines your skin color. Okay. All right, so stratum spinosum is the next layer up. So it consists of 8 to 10 layers of cells, right? Multiple layers. These are keratinocytes. And they're connected to each other by desmosomes. Have we heard of those before? Okay, even if you don't remember all the details of them, desmosomes are anchors, right? So they connect cells to each other. So maybe you remember gap junctions and let's see, cell adhesion molecules, some of those terms. Hopefully those are starting to come back to you. But that was back in that section. All right. So in the stratum spinosum, you have Langerhans cells. These cells serve an immune function. They protect you against microorganisms that got through the outer layers of the epidermis. So again, we're talking about a deeper layer, so they would have already had to go through those more superficial layers. Okay, and These Langerhans cells can also play a regulatory role in some superficial skin cancers. Okay? So sometimes cells can regulate other cells. Next layer up, or more superficial layer, would be the Stratum Granulosum. Another way of saying that is the granny layer. It has 3 to 5 layers of keratinocytes. And by this point, the cells, for the most part, aren't dividing anymore. But these cells make lots of keratin and lots of keratohyalin. Yeah, keratin is very fibrous. It's a protein, very useful in your nails and your hair, and giving it that rigidity. Okay, next, more superficial layer would be stratum lucidum. Lucid means essentially clear or colorless. So you have flat cells here. They're packed together tightly or densely, lots of keratin. Okay, and when you get to lab, it will make a lot more sense in seeing what those cells look like. So the most superficial layer is the stratum corneum. Okay, and corneum kind of is one way of talking about keratinized cells. When they create a lot of keratin, we can say the cells are keratinized or cornified. 15 to 30 layers of those cells. The dead cells are packed together pretty tightly, again by desmosomes. Okay, these anchor cells are anchors. So these cells get shed, not one by one, but in groups or sheets. And they're usually very dry. Okay, that's why you put lotion on. But that dryness actually serves a benefit, is that it makes it harder for bacteria to grow. So again, this process of making keratin by that stratified squamous epithelium in your skin, it's called cornification or keratination. And again, it's stratified squamous because the cells of the apical surface are squamous. They're flat. So how are you going to remember these layers? So I tend to remember it going from the most superficial to the deepest. Okay, so corneum, lucidum, granulosum, right? Spinosum, basal, or germinativum. So CLGSB. Now you can make up your own acronym to remember that. Mine's, come let's get some burgers. Now you can make it whatever you want to make it, but I like burgers, so that works for me. If you like something else that starts with a B, you can put that there. It helps you remember. Works for me, but for me, come let's get some burgers helps me remember the different layers. All right, so let's pause and let's discuss with your partner the different layers. See if you can remember the names of the layers in order. You can go from largest or from most superficial to most deep, or vice versa. All right, let's talk a little about perspiration. All right. Believe it or not, there's actually multiple types of perspiration. You can be sensible or insensible. So insensible perspiration is where water from your interstitial fluid gets to the surface and gets evaporated. You actually lose about half a liter a day through insensible perspiration. And that's through the interstitial fluid, okay? Whereas sensible perspiration is water made by your sweat glands that gets evaporated once it reaches the surface. So if it comes from the interstitial fluid, it's insensible. If it comes from the sweat glands, then S for sweat, S for sensible. I for interstitial fluid, I for insensible perspiration. All right, more about fluid. So if fluid accumulates in your epidermis, you can get a blister. So if the connection between the superficial and layers below get broken, fluid can fill that space. That's what a blister is. All right, a little more about fluid. So if you go into the water, remember diffusion or osmosis is diffusion of water, so you can get osmotic forces moving water into or out of your skin. So if you're in fresh water, water is going to go into your skin. And you'll look like a prune. Okay, because in fresh water, concentration of salt is extremely low. It's high inside, okay, inside your skin. There are cells in your skin. And so water is going to want to go in to sort of bring that concentration down. Look like a prune. So if you take a bath for a long time, you notice your fingers get really pruny. All right, in salt water, opposite happens. Okay, again, you have so much salt outside your cells, water is going to go outside. All right, so the journey of an epidermis cell is 15 to 30 days. And that's how long it takes the cell to go from stratum germinativum to stratum cornea. All right, so cell's going to stay in the stratum corneum for 2 weeks, and then it'll get removed, shed or washed away. So those cells, once they get from the stratum germinativum or stratum basal to the stratum corneum, and they get there and they'll say, we started from the bottom, now we're here. Okay, it was corny, but nobody laughed, but that's okay. I bet y'all remember it on the test though. All right, so skin color. Okay, so skin color of your epidermis depends on 2 factors. So the blood supply, as well as the composition and concentration of the pigment. Okay. So obviously, if you have a lot of blood supply to an area, you give your skin some redness. If you have a lot of pigment, it's going to give you a darker skin color. All right, so the epidermis has different pigments like melanin and keratin. So keratin is orange-yellow. It can get converted to vitamin A. What's it good for? Helps you maintain your epithelia. Also helps you with your photoreceptor pigments in your eyes. So we'll study the eyes toward the end of the course. But very important. People tell you to eat your carrots, good for your eyes. That's why. But it's also good for your skin. All right. Melanin can be black, yellow, brown, or brown. The melanocytes make it, and it serves to protect people from ultraviolet radiation or UV radiation. All right, so the melanocytes, where do you find them? These cells that make melanin, you find them in the stratum germinativum. And they, as the name suggests, they make your melanin, and they'll slowly respond to the radiation of ultraviolet light by making more melanin. Okay, that's why people get sunburns. Okay, so they will make more melanin, but it's not something that happens instantaneously. It's a slow process. So the ratio between your melanocytes and your germinative cells, somewhere between 1 in 4 and 1 in 20. All right, so on your review sheet, there's some questions about effects of ultraviolet radiation. Okay, this is where you find it. Okay. So it can cause mutations or changes in the DNA sequence. Okay, so if you make changes in the DNA sequence, what can that do? Think about what we learned about processes with DNA. Remember, DNA is used to make, anybody remember from the last test? RNA. And RNA is used to make protein. Okay, so if you mess up the DNA, you might make the wrong RNA. If you make the wrong RNA, you might make the wrong protein. Okay. Okay. Can also promote cancer. So if you can get skin cancer, too much ultraviolet radiation. Okay, cause cells to divide too many times. Can cause sunburns, obviously. And it can damage the fibroblast cells, okay, and the connective tissue. All right, so it can destroy your ability to make things like collagen fibers. So what accounts for differences in skin color? Okay, so I mean, one way to think about it is, okay, I'm from this part of the world, you're from that part of the world, but on a more of a genetic level, basically, it's not how many melanocytes you have, it's how active they are. Okay, because we generally, from person to person, have the same number of cells that make melanin, but depending on our genetics, some people's cells make more melanin than others. Okay. All right. So one of the things about skin that you need to know is that the epidermis is avascular. So avascular, if you see A in front of a word, it usually means without. So epidermis, no blood vessels. Dermis has blood vessels, okay? So say it with me, epidermis has no blood vessels, okay? Dermis does have blood vessels. All right, so hemoglobin, you may be familiar with it. It binds to oxygen and transports it through your bloodstream. And hemoglobin turns red when it's bound to oxygen. Okay, it gives your blood that red color. And if you have a reduction in dermal blood supply, which is just below your epidermis, people can look more pale. Okay, the phrase "you look white as a sheet," or "you look sick," or some of these different phrases that people may say just to indicate that you have less blood flow to your face, and it can affect your skin color a little bit. Okay, so cyanosis, another condition, makes the skin look blue. All right. And this is due to a more sustained interruption in your blood supply to the dermis. Okay, so you may have more of a temporary reduction, makes your skin look pale, but if you have a more sustained interruption, your skin can look more blue. And can be caused by things like respiratory disorders, heart failure, asthma. Also can be caused by exposure to extreme cold. And I know a lot of people like to do, you know, cryo chambers and things like that where it's really cold. And, you know, I mean, some people do them and it's just fine. Other people can experience, you know, extreme cold and have some reactions to that. So, all right. So freckles, another skin, not a condition, but you know, it's a characteristic of the skin. So these are spots on people that are more pale skin or pale skinned, and they have pigment on those spots. And these are areas where the melanocytes make more melanin than is necessary, or than what's normal compared to the rest of the skin. And freckles can exist in people of different ethnic backgrounds. Okay, so sometimes people may assume that only certain people have freckles, but people of lots of different backgrounds can have freckles. So, several diseases that affect other organ systems also have some effect on your skin color. All right, so jaundice is a skin condition that causes the skin to look yellow, but it has other health issues. Pituitary gland tumors, you know, can have other, because the pituitary gland deals with a lot of other parts of your body relative to growth, but can also have some skin issues. Addison's disease also can affect height and other issues that also can affect your skin. Vitiligo can affect skin. You know, Michael Jackson's probably the most famous case of vitiligo with skin discoloration. That also can have other health effects as well. All right. So vitamin D, right? So vitamin D is made by epidermal cells. I mean, you can get it in your diet, but your skin can also make it. Vitamin D is also known as cholecalciferol. And again, your epidermal cells make it when they're exposed to sunlight and they get ultraviolet radiation. Okay, so this would also count as sort of an effect of ultraviolet radiation. You know, this is more of a beneficial effect. The others are more negative. So what's the benefit of vitamin D or cholecalciferol? Well, it can be converted or made, help you make calcitriol. And why is calcitriol so important? Well, helps you absorb calcium and phosphorus. Okay, and why does that matter? Well, calcium and phosphorus are helpful in muscle contractions. They're helpful in making strong bones. Okay, very important. All right. So how does your epidermis grow? All right, so it can grow through what we call epidermal growth factor. And epidermal growth factor is essentially a chemical that helps your germinative cells divide through mitosis that we learned about already. It also speeds up the production of keratin. Again, another thing that's going to help your epidermis grow. All right, so it's stimulating the development of your epidermis. So as you're growing from being a fetus to a human, so it's promoting the growth of the epidermis at that point. It's also, as you get older, promotes repair of your epidermis if you get a cut or some other injury. And It also will stimulate activity of other cells to make other things that are needed for your epidermis. So it stimulates the epithelial glands to make different chemicals and secrete those chemicals into the epidermis. All right, so that's epidermis. What I would like for you to do now is take a minute, talk with your partner, and if you're doing this at home, you can review just kind of what you've learned so far about the epidermis. All right, so we discussed the epidermis. Let's talk about the dermis, which is the deeper layer. So it's between the epidermis and these subcutaneous layers. Sub meaning beneath. Dermis has two layers, a papillary layer and a reticular layer that's deeper to the papillary layer. So in the papillary layer, you'll find loose connective tissue. You'll also find nerves that sense different things. You have lymphatics, okay, help you absorb fluid, return it to the circulatory system, and blood vessels. And what does the papillary layer do? Well, it provides support and nourishment for the epidermis. Because again, the epidermis has no what? No blood vessels. Very good. Okay, so again, deep to the papillary layer, you have a reticular layer. And in this reticular layer, you got a meshwork of what we call dense irregular connective tissue. You have all those cells of connective tissue proper. So we talked about the fibroblasts and the mast cells, all those cells that we learned about in the last chapter. So they have accessory organs, so things like sweat glands and hair follicles, and they'll actually extend into the, it says into the dermis, but they're already in the dermis, but they'll, by way of hair follicles, as well as sweat gland ducts, extend into the epidermis. You'll also see blood vessels, lymphatics, and nerve fibers in the reticular layer. And remember, the papillary layer has those dermal papillae, those little bumps that connect with the epidermal ridges. All right, so looking at this in more of a real-world context, so let's talk about wrinkles and stretch marks, right? That's what everybody wants to talk about. So on a chemical or molecular tissue level, collagen fibers and elastic fibers have a lot to do with wrinkles and stretch marks. So collagen fibers are strong and they resist stretching, okay? And elastic fibers will stretch and then recoil back to their original length. Now your dermis it only tolerates a little bit of stretching. It doesn't tolerate much. Now this condition known as skin turgor, and we have the skin being flexible and resilient, in large part due to having water in it. So things like aging, so getting older, hormones, ultraviolet radiation, these things can reduce the amount of elastin in your dermis. And remember, elastin is made, just basically a component of those elastic fibers. Okay, so you're getting less ability to stretch and recoil. And so you get wrinkles and you get sagging. Okay. So another thing that we're going to discuss are stretch marks. Okay, and these are wrinkles and creases in the skin. And this happens when the dermis gets distorted. How does it get distorted? Pregnancy is one way the dermis can get distorted. Another one is substantial weight gain. Okay. So the dermis it's not able then to go back to its original size. Okay. So those pregnancy and weight gain can put stress on the dermis. All right, so another medical application are lines of cleavage. So collagen and elastic fibers, they are what we call oriented, or they're in a sort of pattern that's designed to resist forces that are applied to it. And this pattern of collagen and elastic fiber forms what we call lines of cleavage. Now, when surgeons have to operate on the body, they have to cut the body, right? Now, a cut that's parallel to those lines of cleavage will remain closed, but a cut that's perpendicular to those lines of cleavage will remain open. Okay? So, in order to promote healing and less scarring, surgeons try to cut parallel to those lines of cleavage. Okay? So if they don't, the wound may not heal properly. All right, so let's talk about nerves and blood flow in the dermis. So first, let's talk about the blood flow. So you have two plexi or plexuses in the dermis. You have a cutaneous plexus and a papillary plexus. So they're both networks of arteries, but the cutaneous plexus is in the subcutaneous layer. And it supplies blood to your adipose tissue in your subcutaneous layer, as well as your integument. So this is sort of just below your reticular layer, or just kind of at the border of the reticular layer and the hypodermis. So your papillary plexus is in the papillary layer, and it supplies blood to arterial loops in the boundary between the dermis and the epidermis. Remember the epidermal ridges and the dermal papillae, right? So it can fit little loops in those ridges and papillae. All right, so some medical terms related to this. So an ulcer is basically a shedding of epithelium in a certain location. Now, a bed sore or decubitus ulcer happens when blood vessels that are superficial get pressed against the structures that are deeper to it. So when you get lack of circulation, because those blood vessels are pressed down, it kills the epidermal cells. And those cells in the dermis will deteriorate. So if you've ever worked in a nursing home or volunteered in a nursing home, that's why they have to turn patients to minimize the bed sores. Okay. All right. So birthmarks. So birthmarks are tumors, not necessarily malignant. So don't panic if you have a birthmark, right? So these have basically they are remnants from a tumor that formed in your dermal blood vessels during development. Okay, in most cases, birthmarks are fine. Okay. Now, we talked about blood flow. Let's talk about nerves in the skin. So nerve fibers can play several roles. They can actually control how much blood flows. They can adjust the rate at which glands secrete. And they can monitor receptors. Okay, another medical condition related to skin, dermatitis. Okay, this is inflammation. Anytime you see itis, it's inflammation. Affects the papillary layer. And this inflammation starts typically the area of the skin that got exposed to chemicals or some sort of infection, maybe some radiation, some mechanical stress. Okay, it could be eczema, diaper rash, hives. All right, so we talked about the epidermis, we talked about the dermis. Let's talk about the subcutaneous layer. So subcutaneous layer is also known as the hypodermis. What's its role? Well, it stabilizes your skin relative to the organs and tissues that are below, that are deeper. It can allow some independent movement. Made up of adipose cells, fat cells. It serves the energy reserve as well as some loose connective tissue. Subcutaneous layer is elastic, and relative to the dermis, it has large arteries and veins, okay, whereas your dermis is going to have mostly capillaries and some small arteries. All right, so since we talked about the fat cells, talk about subcutaneous fat distribution. Okay. And so it changes as we grow. So where does the fat accumulate? So for men, okay, so fat tends to accumulate in the neck, in the arm, lower back, buttocks area. For women, breast tissue, buttocks, hips, and thighs. Okay, so it's different for men and women. For both genders, there tends to be an accumulation of subcutaneous fat in the abdominal region. Okay, probably not news to anybody, right? Okay, so let's take a break here, and I want you to discuss with your partner what you've learned about the dermis and the subcutaneous layer. All right, let's talk about accessory structures. Hair, nails, sweat glands, sebaceous glands. So typically these structures will originate from the epidermis and project into the surface of the integument. So for hair, typically most of your skin is going to have hair on it. Exception being your soles of your feet, palms of your hands, sides of your fingers, toes, your lips, parts of the genitalia, okay? So in terms of how many hairs you have, all right, it's over 5 million, okay? So you may think, well, okay, that's not a lot. I got a lot of hair on my head. Well, actually 98% of the hair on your body is not on your head. Okay, it's just all over your body's surface. The hair on your head might be longer, but it's not as many hairs. So the hairs will originate inside hair follicles. Okay? So how are the hairs made? So at the base of your hair roots, you have a hair papilla. And that hair papilla is connective tissue and also has capillaries and nerves in it. Okay? So it has blood supply, it has some nervous control. Now surrounding your hair papilla is a hair bulb. So to produce the hair, you have some specialization of what we call a hair matrix, and it eventually becomes a core or center, what we call a medulla, which is very soft. It has soft keratin in it. And surrounding that medulla, we have a cortex, which is hard. It has hard keratin. Makes your hair stiff. Now the layer of that hard keratin that actually coats your hair is called the cuticle. So you might have heard that in terms of nails, but you actually have a hair cuticle as well. Now your hair root goes from your hair bulb to halfway up to the skin surface. And the shaft then goes from halfway from the surface of the skin to the top of your hair. Okay, so you have the root, then you have the shaft. Okay, let's talk a little more about the hair follicle. It has concentric layers. It's basically, you see concentric, basically they're circles that are together. They form layers. You have an internal root sheath. And it forms a surrounding for the hair root, as well as a deeper portion of that hair shaft. And you also have an external root sheath. It goes from the surface of the skin down to the matrix. You also have what's called a glassy membrane. It's thickened, and it's a basement membrane, and it gets wrapped inside dense connective tissue. Okay, but those are your three layers: internal root sheath, external root sheath, and the glassy membrane. All right, so what does hair do? So hair protects you or your head from ultraviolet radiation, forms cushioning for your head, okay, in case you get hit or you fall. Also provides some level of insulation for your skull. Now, most of us have some hair in our ears and in our ear canal and our nostrils, okay? Some more than others, right? So what's the role there? Keeps foreign particles and insects from getting into your nose or your ear. Now the structure, the root hair plexus. So usually, when you're talking about a plexus, you're talking about some bundle of nerves. And it surrounds the base of your hair follicle. So what's it sensitive to? Well, movement of your hair shaft. Now you also have muscles that connect to your hair. It's the erector pili muscles. And they can make the hair stand up. Could be because of cold, could be anger, rage, could be fear. Now, you have two basic categories of hair. Pretty much all over your body, you have what we call vellus hairs or peach fuzz. Now, on your head, eyebrows, and eyelashes, heavy, deeply pigmented hair are called terminal hairs. So in puberty, you start getting hormones that stimulate your hair follicles, change their structure. So particularly for males, males may have lots of peach fuzz before they hit puberty, and once they hit puberty, may start actually growing more terminal hairs on their face. Now let's talk about hair color. So differences in hair color result from changes or differences in the structure as well as variations in pigments made by the melanocytes. This comes from our genetics, DNA. Your hair's condition is also affected by the environment and hormones. Now, if hair is white, typically means there's a lack of pigment, right? Could also have air bubbles in the medulla of the hair shaft. Okay, so how's hair get grown and replaced? So there's a hair growth cycle where hairs are grown and shed. Hairs typically grow for between 2 and 5 years, and then they get shed. And cells in your hair root absorb nutrients, and they're used in the structure of the hair, and that allows those cells to be used for analysis, see if there's different disorders present or if any drugs are in the person's system. Hairs are also something that's used for what we call DNA fingerprinting, okay, to identify a person. A hair that stopped growing is called a club hair, and it gets pushed out by a new hair. So let's just say by. Now, hair loss in and of itself is not necessarily abnormal. Okay, you're usually going to lose 50 hairs every day. Now, if you lose more than 100 hairs a day, something's going on. Okay? All right. So hair loss that's temporary could be result of things like radiation, too much vitamin A, different hormones, could be pregnancy, stress, drugs, diet, fever. Okay. So example of hormones that can affect hair loss. You have male pattern baldness. So if there are changes in the level of different sex hormones, it can create a shift. And so those terminal hairs can start in that area, they can start having vellus hairs made instead. All right, so we're about to talk about glands. Let's talk with your partner about what you learned about hair. So I think based on the amount that's here for glands in the skin, I think we're going to do this next time. So what I'd like for you to do is work on your exit tickets, and you do your clear point and your muddy point. So if you're at home, you can send me a message in Canvas with your, or you can actually do the discussion as well. So you have access to the clear point and the muddy point, and so you can tell me what you learned and what you still need help with.